More than 80 countries locked down to fight COVID-19. But Sweden takes a different approach. Will their plan for herd immunity pay off? Or could thousands needlessly lose their lives? I'm Imran Garda, and today on the Newsmakers, we weigh up Sweden's coronavirus strategy. The streets of the world's major cities are empty, but in Stockholm, schools, shops, parks and cafes are all open. Sweden has decided to go it alone and take an entirely different approach to combating COVID-19. Yes, social distancing is encouraged, but it's not enforced. In fact, Sweden doesn't look that different than it did before the pandemic. Their herd immunity plan is a risky one, but the government believes it will save lives rather than take them. But its critics don't agree. Sweden's death toll per capita might be lower than the hardest hit European nations, but compared to its Nordic neighbours, Sweden's a lot worse off. In a moment, we'll speak to the doctor responsible for the Swedish strategy. But first, Natalie Perhonen has this report.
Sweden is...
We think this is so that's why we want people, for example, to be able to go out, not be locked in their homes, as long as they keep the social distancing. We think in Sweden this is the way to keep also the long-term public health.
But there has been pushback. The death toll and cases of infections in Sweden are far higher than in its Nordic neighbours, Norway, Finland and Denmark, which each had their own versions of lockdowns. A group of high-profile scientists has called on the government to intervene and take charge of how Sweden tackles the coronavirus. Critics of the relaxed approach have also pointed to the high rates of infection in elder care homes. They account for about half of the country's COVID-19 deaths. Every country is grappling with how to live with the virus. Sweden's method of relying on high levels of public trust in the authorities and fellow citizens has been suggested as a blueprint.
If we are to reach a new normal, I think in many ways Sweden represents a future model of, if we wish to get back to a society in which we don't have lockdowns, then society may need to adapt for a medium or potentially a longer period of time.
But it is too early to tell if Sweden's approach has been successful. Being the global outlier could pay off, but the nature of the pandemic means it's also a gamble. Natalie Perhonen, the Newsmakers.
Well, let's speak to the man who's led the country's coronavirus strategy. Anders Tegnell is the chief epidemiologist of the Public Health Agency of Sweden, and he joins us now from Stockholm. Good to have you on the program, sir. Is this a gamble, this policy?
I think we're all gambling to a certain extent right now. I mean, the countries doing lockdowns are also gambling because nobody knows what the effect of a lockdown will have on this pandemic we're seeing right now. So we're all gambling more or less. I think in Sweden, probably we're gambling less because we are using methods that we are used to in Sweden. We are following laws and regulations that are, communicable disease law. And we're following a tradition in running things in a sustainable way so that we will not have to change course too many times over this pandemic.
Yeah, a lot of people are confused about this because they think that if everybody's gambling, then surely you gamble on the side of caution rather than gamble on the side of throwing people out there and sort of seeing where the cards lie. But it seems as if you've invested in this idea of herd immunity. Is herd immunity working? Is there evidence thus far that it's actually happening?
We are a bit early to say something about that, but what we can say is that we see a very clear leveling off of the number of cases in the Stockholm and surrounding areas. And in the last week or so, we also see the diminishing amount of cases coming into intensive care, diminishing amount of cases entering the hospitals. And so that, I think, to a certain extent, probably is depending on that we have an immunity in the population now that slows down the spread of the virus in the Swedish society.
Last week, Friday, I was reading Bloomberg, May the 1st. They had this article on Sweden's policy. So I'm going to quote them to you. It said Sweden's 2,586 deaths, of course it's more now, compare poorly with Denmark's 452 and Norway's 207. Taking population into account, Sweden has suffered more deaths per million people than the US. Now, I read that and I think, oof, maybe the Swedes have got it wrong. They're stating fact here. You don't need Bloomberg to give you the numbers of your country compared to others, right? But don't you think, okay, maybe we tried something, but perhaps the evidence, perhaps it's not bearing fruit, maybe we need to change course, like the UK did?
Yeah, I mean, there are different parts to that question. First of all, we are in different parts of the epidemic, and we don't really know where we're going to end up until this is all over. And that's going to take probably years from now before we know that for sure. The second part of it is that, unfortunately, we got a lot of cases in our elderly homes in Sweden. And that's, to a certain extent, is a separate issue, because we're trying a number of measures in those homes, and we see that they are paying off to a certain extent. So, and there is a lot of other things to this than the death toll, even if death toll is always regrettable. I mean, having a lockdown with children not going to school is causing a lot of consequences for children. Having a lockdown and people not being able to see each other also causes a lot of consequences to people. Having a lockdown, a lot of people losing their jobs will also have a lot of public health consequences. So I think it's going to be a time for reckoning and seeing the complete effect of this in the long term. But it's far too early, and I think Sweden's death toll compares favorably to many places. New York in the US, for example, Belgium, Netherlands, UK, a number of countries in Europe. So this is not an easy disease to have any clear answers to yet.
Dr. Tegnell, are you confident enough to say that other countries that have harshly locked down are wrong?
No, I don't think anybody is going to come out of this. We can say that they did something wrong, because this is a very complicated situation. And you need to do and use the tools that you have in place in your country to make the best of it. And that's what we have done in Sweden, and that's what we continue to do, because we continue to look at the situation, see what more things we need to put in place, and maybe what things we now can ease up on when we see the diminishing amount of cases.
Yeah, as we heard from Michael J. Ryan from the World Health Organization in Natalie's report in the preamble to this discussion, he said that Sweden represents a future model. He didn't say now, but it represents a model that perhaps other countries can sort of map and copy later on. Would you advise other countries to copy your model now, to follow your example, or is this only custom made for Sweden because Sweden has a particular set of parameters that you are working within?
I think we all can learn from each other in this situation, and I think there are things to learn from Sweden, and I think countries are already learning from Sweden. I think now a number of countries are opening up their schools, and I think, at least to a certain extent, that's based on our experience in Sweden, where schools have not proven to be the engine, the motor of this pandemic. Rather the opposite. We have extremely few cases in schools, and we don't have many cases among children, among parents and teachers either. So I think this is really a time where we can work together and learn from each other.
It seems as if you have a policy where, unless your symptoms are extremely severe, even if you are diagnosed with COVID-19, then you're not hospitalized. Is that a policy that you believe is the right one?
I think no country will hospitalize people who are not sick enough to benefit from hospital care. I mean, that doesn't make sense in resources. I think the situation in Sweden is very different. We tell everybody to stay home. With the slightest symptoms in the morning, stay home and see what they develop to. And I think that's part of the reason why we now have a fairly flat curve, and why we have a curve that's even slowing down, is that people are really staying home when they feel the slightest symptoms, and I think that takes away a lot of the contagion in the society.
One of the reasons why I ask you is because you would be aware of the case of Emrullah Gülüşken, a Turkish national who had to be evacuated from Sweden by Turkish authorities in a Turkish air ambulance after his daughter made an appeal on social media. When you see that somebody who's sick with COVID-19 has to be evacuated to another country, does it embarrass you or not?
I wouldn't comment on the individual cases, but let me say like this, that at any given time there's been at least 20% empty intensive care beds in Sweden. nobody in the need of healthcare or in the need of intensive care in Sweden has been denied it, and that is including citizens from other countries.
Anders Tegnell, pleasure having you on the Newsmakers. I thank you very much for joining us.
Thank you.
Well, we've heard from the man behind Sweden's strategy, but could nations going it alone become the new norm after this pandemic is all over? As COVID-19 put open borders and maybe even open trade at risk? Well, to discuss that, we're joined by classical liberal theorist Johan Norberg in Stockholm. He's the author of The Virus and the World and In Defense of Global Capitalism. And Alfredo Saad-Filho is a professor of political economy and international development at King's College London. Johan, first of all, your reaction to, I'm assuming you heard the interview with Anders Tegnell, your reaction to that?
Well, there you see what kind of individuals Sweden is looking for in the midst of a crisis. Some countries want some sort of authoritarian strongman, the Donald Trumps of the world, to point with his whole hand. We prefer some sort of more technocratic, an expert, someone who's written a dissertation and done research, not incredibly charismatic, but he knows what he's doing. And what I would say generally about it is that I think that he has won many friends, Anders Tegnell, in Sweden, and it seems like in the polls, the public trust in him and in the Public Health Authority has increased quite dramatically during the crisis. So he seems to be the man of the hour in Sweden.
Well, I wish he was still on so that he can respond to your claim that he doesn't have any charisma, but I'm going to put that aside. Alfredo Saad-Filho, the fact that during the crisis, if we all can't agree on a way to tackle COVID-19, as we're seeing the Swedes are doing it very differently to others, what does that suggest about the world after COVID? Are we going to see more disagreement because we don't agree on many of the fundamentals here?
I think it is possible that we will see a world with more disagreements, but not because of policies to address the pandemic. Countries are responding as they can, depending on state capacity, depending on their political systems, depending on different perceptions of the threat of the pandemic and the implications of economic collapse. But the world is probably likely to come out of this pandemic traumatized by policy measures being taken, particularly by large countries, especially the United States. Policies hostile to an orderly international system, policies hostile to international solidarity. The European Union did not do very well at the beginning of this process. The United States is doing increasingly worse later in this process and as the November elections approach. I am concerned about that more than about the pandemic itself in terms of the international system.
Johan Norberg, people are giving up freedoms, yes, but the argument is that these are temporary freedoms to give up because most people buy into the idea that it's best to be safe than be sorry. So we're going to stay at home. And yes, if the police have to lock up somebody who's not adhering to the rules so that we can protect the collective, so be it, because we're in the middle of a global pandemic. Do you agree with that?
Well, rulers always say that, right? This is a particular crisis, and at this moment I need extraordinary powers. But do they hand those powers back after the crisis is over? That doesn't always happen. So that's one reason why I think we should be a little bit cautious about handing them those powers. I also think it is kind of a mistake to assume that the only way to use precaution is to lock everything down and to close all the borders, because there's disagreement between health experts when it comes to the right policy. The one thing we do know is that a complete lockdown of societies, of economies, of borders result in terrible economic outcomes, a massive increase in poverty. We've heard the worries, the warnings from the United Nations and the World Bank that we'll see a surge in poverty and in hunger. And that's also something we have to take into consideration before we make these incredibly important decisions that we will have to live with for years.
Alfredo, what does it mean that a couple of months down the line, we're having this conversation, that there are those who are itching for what they say is more liberty in the face of what they perceive as authoritarianism. What does that say about everything, really?
It says two things. One, it says that neoliberalism, global neoliberalism, has got in itself authoritarian tendencies that have been exacerbated over the past 40 years, and that became particularly prominent after 9/11. But it says something else as well. It says that this is a dilemma for rich, prosperous countries with the economic resources to make this choice. Most developing countries, the vast majority of the population of the world, over 80% of the population of the world, do not have states with the capacity to enforce lockdowns, do not have states with the capacity to provide healthcare, do not have states with the capacity to come out of lockdowns. These states have the real problem, and I'm afraid we're focusing on the problem of the rich instead of focusing on the problem of the majority.
Johan, first world problem?
I think in this kind of world we're living in, first world problems will become the problems of every other part of the world as well. Unfortunately, the first thing we see when we have a dramatic reduction in consumption in rich countries is that we have mass layoffs in many emerging economies in low and middle income countries and it has a terrible effect on poverty when it comes to hunger and so on. But I do agree. I think that many of the discussions that we have about the lockdowns, the particular road to go now, that might not be the most important one. The most important thing to think about right now is, first of all, how do we keep those trade flows open? How do we keep that mobility open? Because the economies of both rich and poor countries are dependent on that. But second of all, how can we make sure that a capacity in every country is increased as rapidly as possible when it comes to, for example, hospital beds, when it comes to ventilators and so on? And there I would like to see much more international cooperation than we have a hospitable climate for right now, unfortunately.
Alfredo, are those trade flows heavily under threat?
Trade flows are under threat because of country responses or impact of the pandemic on countries, and then the responses of countries, both at the level of maintaining the priority of international integration, but also at the level of the mutual supply and support. Production chains, supply chains have suffered badly, if you think aviation, automobiles, and other supply chains. But what we have also is a product of 40, 50 years of neoliberal order that reorganized production at a global level with very little spare capacity, very little resilience. It's a system that is very lean and profitable for individual companies, very rational for individual companies, but it doesn't work at the international level. So you see the consequence for the United States or the United Kingdom, countries that have very high levels of income per capita, but cannot provide ventilators for their population. They cannot provide personal protective equipment for their health staff, and then must scramble around the world, hoovering up whatever they can and destabilizing poorer countries in this process.
Johan, is that because the social pact in a place like Sweden is just very different to everywhere else, where the trust in government is so much more than elsewhere, that if other countries tried to do what Sweden was doing, they would invariably fail?
Well, that's a good question. And this is one reason why it would be arrogant to try to come up with one kind of blueprint for every country around the world. We have a particular history in Sweden of trust in experts, in interpersonal trust, our neighbors and authorities and in the government. So when they recommend social distancing, for example, we do tend to listen to that. I'm not sure that that would work in every other country around the world. So that's why I think we need to see various different responses based on local culture and tradition. And but Sweden is also dependent on other countries when it comes to this discussion about trade flows around the world. We are dependent on components we have a ventilator industry in Sweden, but every ventilator is built of 500 different components. We can't afford to have 500 different factories building every one of those components. In that case, we wouldn't even have the number of ventilators that we have today. So even though we are a little bit vulnerable when it comes to international trade flow, dependence on countries on the other side of the planet, it also means that we get better goods cheaper than we would otherwise have, and we have much better access to medical technology than we would have in a closed world.
Alfredo, whether people are devastated by the deaths caused directly by COVID-19 or by economical and societal lockdowns and its consequences, there seems to be a general view that this will invariably lead to greater hyper-nationalism, greater insular politics, protectionism, and so on. Do you share that fear?
I think this would be a misguided response, of course. What I think the pandemic has shown in the countries that have been more successful addressing it and countries that have not been very successful is that it is primarily a matter of state capacity. State capacity to provide healthcare, state capacity to coordinate a national response to the pandemic, state capacity sometimes to impose lockdowns, and sometimes not to impose lockdowns, but to be able to provide healthcare early and fast. This is the lesson. But what is possible is that we come out of this crisis with a world system that is much more fragmented, with a world system that is much more disintegrated, that is much more aggressive. But that is a political choice. This is a political choice that at the moment is being led by the government of the United States, the president of the United States in particular, and this can have consequences for the rest of the world because of the special size and role of the US economy. What we need is solidarity. We need joint efforts funded by the more advanced, prosperous, wealthier countries to provide a benefit for humanity as a whole. If we can take a positive lesson, I think that should be the lesson from this crisis.
Not Alfredo,
the other one.
Right, Alfredo, have they learned over the past 3 months?
If you look at recent discourse coming from the leadership in the United States, absolutely not. And it's becoming even worse as the days pass by. This is absolutely tragic. It is a policy of confrontation at the international level. It's a policy of fragmentation at the internal domestic level. And this sets a terrible example for the rest of the world. Absolutely terrible. So we do need an international politics grounded on the recognition of society and sociability, and the recognition that in a pandemic, there are no individual solutions. There are only collective solutions at the global level.
Johan Norberg, if Donald Trump was listening to you, what would you advise him to do right now?
Well, precisely because I share this fear that we will all be much more vulnerable if we're trying to go at this alone. I would tell him that America suffers as well from the kind of nationalism and protectionism that he's into right now. The World Trade Organization and various international forms of cooperation to avoid a beggar thy neighbor policy. For example, when it comes to medical technology, to safety equipment and so on, we need to make sure that we won't see a surge of export bans that increase the price of it all and reduce the access for everybody. Now's the time when we really need that kind of international cooperation, and we'll come back to bite America as well if he continues with this kind of undermining of, for example, the World Trade Organization that is now completely out of function because all the attempts of having impartial judges making sure that people abide by the decision, that has been undermined by the United States. And now it's a kind of a free-for-all, and we will all suffer, America as well.
Okay, gentlemen, been a pleasure talking to you here on the Newsmakers, Johan Norberg and Alfredo Saad-Filho, and earlier, Dr. Anders Tegnell. Wish you all the best and hope to speak to you soon. Thanks for joining us. And we thank you for watching the Newsmakers. We will see you next time. Bye-bye.